Hello channel friends. How are you? Today I want to talk to you about osteoarthritis, also known as osteoarthritis, which is a degenerative disease that affects the joints, being one of the most common conditions in people over 60 years of age, but which can affect younger people. It occurs when the cartilage that protects the joints wears out over time, resulting in pain, stiffness and, in advanced cases, limited mobility. I know how painful and limiting osteoarthritis can be, and it is exactly this concern that motivated me to create this video. I want to offer useful and natural information for those who face this challenge daily, helping to improve the quality of life and bring more comfort to those who suffer from this condition. Take advantage and like the video, comment if you have or know someone who suffers from osteoarthritis, and please send this video to that person you thought of, this one. I'm sure it will help you. The main symptoms of osteoarthritis include pain that worsens with movement or after long periods of inactivity, swelling, loss of mobility, and morning stiffness. The most affected areas are the knees, hips, hands, and spine. The progression of the disease can lead to joint deformities and difficulty in performing simple daily tasks, such as walking, climbing stairs, and even washing everyday dishes. Identifying the symptoms of osteoarthritis can be challenging, especially in the early stages when signs may be mild or intermittent. However, there are some common manifestations that help to recognize the condition. First, joint pain. Pain is one of the first signs of osteoarthritis. It tends to occur during or after use of the joint, being more noticeable after physical activities or long periods of inactivity, when getting up in the morning, for example. The pain can be localized and vary in intensity, worsening over time. Then there is morning stiffness. Many people with osteoarthritis report joint stiffness in the morning or after periods of rest. Typically, this stiffness disappears or decreases significantly after about 30 minutes of movement. Another classic symptom: swelling and tenderness. Affected joints may appear red and swollen due to local inflammation and sensitivity to touch. In advanced cases, bone nodules, such as heberdens on the fingers, may form. These nodules begin to seriously compromise mobility and finer movements. Clicking or squeaking can also be common. The sensation or sound of pops when moving the joint is common due to friction between the bones, caused by the wear of the protective cartilage, the famous tec-tec. Loss of flexibility can be a symptom that can be slowed down with regular exercise and stretching, but as the disease progresses, the joint can lose its range of motion, making simple tasks, such as bending the knees or stretching the arms, more difficult. Compromised by pain. Joint deformities will usually appear in the more advanced stages. The joints may develop visible deformities, such as deviation of the fingers or change in the alignment of the knees. And as a consequence, fatigue and muscle weakness around the affected joint arise due to chronic pain and difficulty moving, especially if the patient avoids using the joint due to pain. When to seek medical help. If you notice symptoms such as persistent pain, prolonged morning stiffness, or difficulty carrying out daily activities, it is important to consult a doctor. An early diagnosis can help slow the progression of osteoarthritis and improve quality of life. Osteoarthritis treatment is focused on relieving symptoms and improving quality of life. It may include medications, analgesics, non-steroidal anti-inflammatory drugs, and, in some cases, intra-articular injections of corticosteroids or hyaluronic acid help reduce pain and inflammation. Physiotherapy. Specific exercises strengthen the muscles around the joints, increase flexibility, and help reduce the impact on the joints. A lifestyle changes. Weight loss, practicing low-impact activities, such as swimming and walking, and a balanced diet. Complementary therapies. Acupuncture and massage may be useful for some patients. Lastly, surgeries. In severe cases, arthroplasties, joint replacement, may be performed to improve mobility and alleviate severe pain. But, as here on our channel, we believe in the transformative power of natural treatments and the wisdom that nature offers us, we will address natural and effective ways of treating osteoarthritis, exploring alternatives that help alleviate pain and improve quality of life without the side effects of traditional medicines. If you are looking for health in a conscious and holistic way, you are in the right place. Let's go. Natural treatments for osteoarthritis can be important allies in relieving pain and improving quality of life. Although they do not cure the condition, they help reduce symptoms and promote well-being in a less invasive way. Here are some approaches. First of all, you need to have an anti-inflammatory diet. Consuming foods that fight inflammation can help alleviate symptoms. Give preference to omega-3, present in fatty fish such as salmon, sardines, and flax seeds. Fruits and vegetables, rich in antioxidants, such as berries, oranges, spinach, and broccoli. Turmeric. Turmeric contains curcumin, an anti-inflammatory substance. Ginger may reduce inflammation and improve joint mobility. And of course, avoid processed foods, refined sugars, and trans fats, which can worsen inflammation. Make phytotherapy your private pharmacy, without forgetting that all excess becomes drugs. Abuse nature's wisdom, but use its wisdom to make the best use of it. Boswellia serrata, also known as frankincense, is a medicinal plant native to India widely used in Ayurvedic medicine. Its resin contains active compounds, such as boswellic acids, which have anti-inflammatory, analgesic, and immunomodulatory properties, making it effective in the treatment of inflammatory diseases and joint pain, such as arthritis and osteoarthritis. The plant acts in the body by reducing the production of inflammatory mediators, such as COX-2 and LOX-5 enzymes, relieving inflammation without the common side effects of traditional anti-inflammatories, such as gastric problems. Additionally, studies suggest that it may be useful in treating conditions such as asthma, inflammatory bowel diseases, and even controlling some types of cancer, although these applications still require more research. Generally, Boswellia is consumed in the form of capsules or extracts. Despite being considered safe, mild side effects, such as nausea or abdominal discomfort, may occur. Its use should be avoided by pregnant women, nursing mothers, and young children without medical supervision. It is a promising and increasingly studied option as a natural therapy for chronic inflammatory conditions, and it is important to consult a healthcare professional before starting its use. Devil's claw, proven to help relieve joint pain. It can be consumed in tea or capsules. Green tea, rich in polyphenol, it can reduce inflammation and protect cartilage. Don't forget to do low-impact exercises. Maintaining joint movement is essential to prevent stiffness and strengthen the surrounding muscles. Choose activities such as light walking, yoga, Pilates, and swimming or water aerobics, which reduce the impact on your joints. Choose something that brings you pleasure and interaction with friends. There are also alternative therapies that can be extremely effective in treating osteoarthritis, as in many cases, they reach the root of the problem. Acupuncture helps relieve chronic pain and improves local circulation, reduces inflammation, and stimulates joint regeneration. Therapeutic massage reduces muscle tension and improves joint mobility. Thermotherapy, application of hot or cold compresses to relieve pain and reduce inflammation. Ozone therapy. Ozone produces clinically relevant benefits that support its use for analgesic effects, relief of pain, stiffness and physical disability, reduction of joint inflammation, and significantly improves the quality of life of those experiencing pain. We have a video on the channel that extensively explores the benefits of ozone. If I were you, I wouldn't lose. I'll leave it pinned in the video description. Be sure to consume some natural supplements. These below are essential to help you overcome osteoarthritis. Glucosamine sulfate and chondroitin support cartilage regeneration. Vitamin D and calcium, essential for bone health. Type 2 collagen contributes to the elasticity and resistance of joints. Another important thing, maintaining a healthy weight reduces the strain on your joints. Working on posture also decreases stress on areas like the knees and hips. Hence the importance of exercise or physiotherapy. And lastly, but with great importance, massages with eucalyptus, lavender, or ginger essential oils. They can provide temporary pain relief and muscle relaxation. After all, we deserve moments like this, don't we? But before starting any natural treatment, it is important to consult a doctor or physiotherapist, especially to ensure that it is compatible with other therapies in use. I'm sure these tips will be extremely useful in your life, as they are all approved, and every day more and more scientists are understanding the importance of this care. The natural treatment for osteoarthritis is a journey of patience and self-care, and can transform the quality of life in a profound and lasting way. Remember, every small choice counts, and you deserve to live with more comfort and well-being. If you liked this video and believe in the power of natural treatments, don't forget to subscribe to the channel, like and share with those who can benefit from this information. Your interaction is essential for us to continue growing and bringing rich and transformative content. Thank you very much for watching, and see you in the next video.